Hello, everyone. I would like to introduce Dr. Chloe Giordano. She's today's guest, and she's the founder of Neuronation Physical Therapy and Wellness. Welcome to the show, Chloe.
Thank you for having me here.
How you doing today?
I'm doing well. How are you?
Good, good. So, can you tell us what inspired you to become a physical therapist? And the second question will be, what inspired you to start your clinic?
Yeah, so first question with wanting to be a physical therapist. So my mom was actually a nurse, and I always thought I would go into the healthcare field. She would read me books on anatomy when I was really young. And then my dad ended up having ACL surgery, and I got to see what physical therapy was. I was an athlete growing up, so it kind of merged the two of my mom being in the healthcare field and then the athletic side of sports. And that's why I wanted to be a physical therapist. And then second part of why I started Neuronation was because I always felt that people with neurologic conditions were severely undertrained and underdosed, and I wanted to take my sports and athletic background and bring that more into the neurologic field.
Okay, very good. And so, tell us, prior to starting Neuronation in 2022, correct?
Yes, that's
Um,
correct.
Did you work in an outpatient setting, home care setting? What did you do prior to starting a clinic?
Yeah, so after I graduated physical therapy school, I worked in inpatient rehab hospital in Jacksonville, Florida, called Brooks. It was a very intensive inpatient rehab where we saw people with all types of neurologic conditions. And then I ended up moving to North Carolina for a job where I worked in home health. So I really liked home health, but the one big drawback is, at least with the company I was working with, we didn't see people for very long. And also, I didn't see a lot of people with neurologic conditions. And I know that could have just been a little bit more rare just based off of the company I worked for. But I really loved working in the home and being able to see people in their natural environment. So I kind of brought my inpatient rehab experience into the home. And that's why I started Neuronation.
Great. So you moved from Florida to North Carolina, work for a
Yep.
home health company. And then, so I'm just assuming you're providing mobile outpatient services, correct?
Yes.
That's what Newer Nation Physical Therapy does, right? Um, do you participate in any insurances, or is it strictly cash-based services?
Yeah, so we have a little bit of a hybrid. So we mostly take people with Medicare insurance. That's our primary population, but we also see people on a self-pay basis. So we have both the physical therapy side and then long-term wellness programs, which are all cash-based and private pay.
Okay, very good, very good. And so, can you talk to us a little bit about unique strategies that you use, to work with stroke survivors, patients with brain injury and spinal cord injury? Anything new happening in the field?
Yeah, I wouldn't say this is necessarily new, but a big thing that we focus on is neuroplasticity. So we take those 10 principles of neuroplasticity, and I really like to work high intensity. So that's a lot of the research right now is high intensity and neuroplasticity. That's been in the research for a while, and just keep repetition after repetition after repetition. We really want to work at a high intensity, as high as possible, especially in the patients that have neurologic conditions, because a lot of times people will just sit and do sitting leg kicks, and that's not enough. It's not, they need to be standing, they need to be walking. We need to push them as much as we would push any other athlete that had an ACL injury. It's just figuring out ways that we can adapt to what their current level of needs are, but still getting that intensity.
Okay, very good. Thank you for clarifying that.
Mhm.
What challenges do you have providing in-home therapy to your neurological patients?
Yeah. So in home, you really never know what you're going to walk into. So you're going to someone's house almost blind. You don't really know, if there's going to be pets. I've walked into situations where a patient has had a potbelly pig that's living in their house, dogs, cats, animals that sometimes get in the way, and sometimes it's just we integrate it in physical therapy. You never know what you're going to walk into, but it's always makes it fun. And then one of the other limitations can be sometimes the equipment we can bring. I can't bring a huge body weight support treadmill system into a patient's home, but we can find ways to modify and adapt to their needs. But it's just really having to be a little bit more creative than you do in the clinic where you have all types of equipment at your disposal.
Yeah, absolutely. I could definitely relate as an OT. And I actually treated patients in the home and having a huge dog that, just kind of runs up to you and you don't know if, the dog is peaceful or not. And it's definitely a challenge, especially if you're
Yeah.
trying to walk a patient with, that has stroke and this dog is, following you or running in front of you. Definitely. And so, Chloe, so how many therapists currently provide services for Neuronation?
So right now we have two full-time physical therapists, including myself, and then we have two other therapists that are like PRN part-time as needed.
Very cool. Like a little over
Yeah,
two
right
years.
now,
That's great results, I would say, for a business that started, just a little bit over 2 years ago.
yeah.
Um, so speaking of starting a business, right? So again, we have audience that, either started a business or looking to start a clinic. What were some challenges you had starting a clinic? And did you go right into full-time, operating clinic, or were you working full-time or part-time while you were opening a clinic? Can you take us through the journey?
Yeah, so I was working in home health to start full time and then just started seeing some patients on the side, either along my work day or after the work day. So the beginning part was definitely very long, like grinding it out. It was a lot of time, a lot of effort. I had a great support system that definitely helped me get through it because it was just very long days of trying to manage a full-time role in home health and then building up my client list and starting Neuronation. So I started full-time, eventually dropped down to part-time in home health and ramped up more full-time in my business and then eventually just went full send into it and went out on my own. So yeah, it's definitely a grind to get there. But it was something I knew I was passionate about and wanted to keep working at. So there was a light at the end of the tunnel.
That's great. That's great. And I guess some listeners would be interested in knowing how long did it take for you to actually become full-time and quit your home health job?
Um, I want to say it took me maybe a year, give or take.
Okay.
So yeah, maybe a little less. I can't remember the exact timeline. All of it seems like a blur right now of the beginning. But yeah, I think it was maybe a year, a little bit less than a year that I ended up going full time in my business.
That's great, honestly. I mean, did you have a
Yeah.
goal in place? Like, I want to be full-time, and I want to quit my job within a year, or you didn't have such goals?
I really didn't set that type of goal in the beginning. I knew I just wanted to build the practice and keep going, but I didn't set really strict timelines on like I need to be out of this job. I actually really loved my home health job. I had a great manager, so I at least was fortunate in that regard where it wasn't like I need to get out right now and like put pressure on myself of getting out. I just knew I wanted to stick with the process, like slowly build, grow, build a really good foundation of the business and then transition into that. But I didn't want to build based off of speed just to get out because that's not going to be helpful in the long run.
Okay. Okay, makes sense. And what did you have any sort of marketing? Did you run any ads? How did you get your first five patients?
I didn't run any ads. Marketing was a lot of either former clients in home health that have, they were discharged and, sent them to outpatient, or they really didn't have a good experience with outpatient and they reached back out to me. Um, that was one area. Another area was just making connections in the community. I live in a small town in Hillsborough, North Carolina, and there's
Hmm.
a business group, which was really helpful. So just making connections within the community there. It's kind of similar to BNI, but it's more just like a local group, which
Uh-huh.
was really helpful. Just building those connections and just talking to people, seeing how I can help them, and just putting the word out of our services.
Okay, cool. And then did you have a mentor when you started or prior
Have
to starting? Did you have a
have
mentor?
what?
A mentor.
I did. So I worked with a group of mentors, uncaged clinicians, to
Oh, it's a
start.
Facebook group, right?
Yeah.
Yeah,
Yeah.
it's a
So I
popular
ended
one.
up I ended up working with them through, I guess, kind of like their startup program. So that was very helpful to get everything off the ground, and just figure out what are the basics I need for a business. Because obviously, going to physical therapy school, we learn the physical therapy side, but they don't teach us a whole lot about the business side and what is needed to be done. So it was great to have a group of mentors to help figure out all the different things that I needed through people that have done it before. And then just using Google a lot and figuring out what I need and just researching.
Amazing. So, guys, for you too, who's listening, uh, Engaged Clinician has been a popular group among physical occupational speech therapists. So, a lot of resources. People ask questions, and I think it's a great resource for those that are starting out or just recently started. If you want to connect with other providers to provide in-home or clinic-based care, I think it's definitely a great group to join on Facebook.
Yeah.
Oh, wait, and then when did you hire your first therapist?
This September, so not that long ago, was when well, I guess that's my first full-time therapist. So, but as far as like PRN part-time, um, maybe July, June.
Okay. Just
So,
2024.
yes.
Okay, so that's good. It took you about 2 years before you were able to start hiring PRN
Yeah.
therapists.
Yeah, I was looking for a pretty long time, just trying to hire someone, but it was really challenging to find a good fit, especially because I was looking for someone that was either PRN or part-time. I didn't really have enough on the schedule yet to get a full-time position, so
Yeah.
I think that was a little bit challenging. So I worked on, building up a caseload as well. So then I could find a full-time therapist as well and have a PRN part-time therapist. So that's very
Yeah.
helpful.
So yes, it sounds like hiring is from what I see from other clinic owners, especially in specific areas, like maybe not like major metropolitan areas, but smaller towns, hiring's been a challenge for a lot of these owners. And what do you use for hiring? Do you use specific platforms, or is it word of mouth, or is it connections that you build?
A little bit of everything. So mostly Indeed is where I found good clinicians, and word of mouth. Just asking people in my community of, hey, do you know any physical therapists that are interested in neurologic conditions or at least willing to learn? I think that's one of the challenges is a lot of people don't have experience with people with neurologic conditions, or maybe, they have a clinical in school, for a few weeks. So I think that can sometimes push people away or scare people because they feel like they don't know what they're doing. And that's okay from our end as long as somebody's willing to learn, like we can teach them. We're really looking for a good personality and a good fit to help care for our clients in people's homes. And, we can teach them the rest, hopefully.
Yeah, absolutely. Makes sense. So Chloe, I want to talk about your wellness program. So how do services like private fitness, wellness programs, group education complement traditional therapy?
Yeah, so it really depends on what the patient and the client needs. So sometimes we can do it in conjunction with our traditional physical therapy services. Maybe as far as physical therapy goes, they only qualify insurance-based twice a week, 3 times a week, but they're really wanting 5 times a week somebody to come in and see them so we can supplement with our wellness programs where maybe we're just reviewing their home exercise program or just walking them to walk where it's not skilled, but it's just something that they won't do on their own or their caregiver won't do on their own. So we can come in and help supplement their physical therapy services. Another option that we do is once people have graduated from physical therapy, so to speak, we can transition them into our long-term wellness programs. So the goal is, get them as independent as possible with physical therapy and then transition them to those long-term wellness programs so they can maintain all of those gains that they had and not decline or move backwards.
Continuum of care. Very good. Very
Yeah.
good. And do you offer packages for your patients?
Mhm.
Yeah.
Yeah, so we do monthly packages for the wellness side, just a little bit easier to navigate. We either do like 4 times a month, so like once a week, or 8 times, which twice a week. And then, go from there. So most of the time people are on monthly packages where we go and see them. But we also rolled out a new wellness program not that long ago that's online. And that one is just continuing month-to-month basis. The program gets progressively harder, but we don't come out and see them. That's just something they do on their own.
That's cool. Very good. And uh, Chloe, what is the long-term goal for Neuro a Nation?
Yeah. So long-term goal, ideally, I would love to also have a clinic so we could use some of those um, bigger exercise equipment pieces and also provide in-person group fitness programs. So we would have a hybrid of we can still go to people's homes for people that need it, but some people just love the community aspect. Some people really need those pieces of equipment that we just cannot bring to the home. And some people just want to get out more from their home and do these exercise classes. So having a combination of both to really help satisfy the needs of our patients, I think, is a really big goal for us.
Okay, very good. And is that something you look into already, like for space, or are you only contemplating stages for that?
A little bit of both. So I'm wanting to grow our therapist practice first, so build a little bit more of a full-time therapy group, and then probably transition to have some therapists in person in a clinic, and then keep some mobile where they can go to people's homes.
Very good. I think it's a great idea, and I have
Yeah,
spoken to many therapists that have a very similar model, and I
yeah.
think it's the best model where you offer your patients to transition to in-clinic treatment, right, once they finish with their mobile visits. Very good. And Chloe, and as a treating therapist and a business owner, what are some challenges? How do you find balance in managing your business and then also treating patients?
Yeah, I think the best thing that has happened is figuring out a schedule of what days are my primary patient care days and what days are my admin days instead of trying to do both. In the beginning, it's really hard though. You're
Yeah.
seeing patients and you're doing admin and everything is every day. Really making sure you set aside time, whether it's on the weekends, during the week for yourself, and self-care, whether it's exercising, going for walks, or just anything to kind of decompress from the day is very important. But right now, setting a schedule has been very helpful where, maybe one day a week is strictly for admin day, and I try and get everything done on that day. And then the rest of the days are patient care days.
Uh-huh. Very good. And so you treat what 4 days a week and then 1 day a week you're set aside for business management. Is
That's
that how
what I
you?
started. Yeah, that's what I started with. Now I am 2 days a week of patient care and 3 days a week of like admin, marketing, everything else.
Oh,
So
nice. Nice. So now you're
yeah,
treating twice a week and the business management. So okay, 3 times a week, correct?
yes, that's correct.
I like that. Actually, I agree. It's people that are starting out, they generally do not dedicate specific days for admin work, and sometimes they
Hmm.
don't need to because they have very few patients. But as you grow, I agree it's extremely important to have specific days that you dedicate just for business management
Hmm.
versus patient care. And then You mentioned marketing, so you do market now, and if you do, what can you tell us more about the marketing strategies that you have and what has worked, what hasn't worked, um,
Yeah.
for your business?
Um, Yeah, so as far as marketing goes, really just trying to make connections in the community, providing free resources. So I'll do some exercise classes for free at this place called Snow Approach Foundation. They're local in Hillsborough. So I'll provide some free exercise classes, and anyone that wants to show up, they can show up. And then, sometimes that gives me eyes on certain clients of like, hey, your balance doesn't look so great. I think we should take a look at this just to prevent falls, or maybe they've already had a fall and they're wanting to ask me questions or ask one of our staff members questions. It helps us get into their home a little bit easier and put the word out there more. And just different networking events that happen around the area and making connections with other people that are doing like-minded things. So I know a group of PT, OT that also go to the home. So it's really helpful. Right now, we don't have any occupational therapists, but at least I know somebody like, hey, you need occupational therapy. Here's this group. Same thing with speech therapy. I've made great connections with a speech therapist that's local to the area who also goes to people's homes. So just trying to figure out how we can best serve our patients and anyone else in the community too. There's a lot of give and take, hopefully. I can't do everything on my own. Nobody can. So if I can help somebody, if they can help me, great.
Awesome. And then one of the questions I currently hear when I speak to founders, do we market to doctors' offices, right? Or we strictly, kind of do paid advertisement? Have you found marketing to doctors beneficial? Have you had any referrals from doctors, or that's not type of marketing you're
In
focused on?
Yeah, in the beginning, I was trying to market to doctors to see if I could get clients, and it didn't really seem to work out. And it was also in the very beginning stages. So, there's a lot of just different things trying to see what would stick. And that was not one of the things that stuck for me, but for other people, it does work. I'm in an area, Raleigh, Durham, Chapel Hill area. So we
Uh-huh.
have huge medical centers between Duke, UNC, and Wake Med. So I think it can be a little bit challenging to break into those big healthcare systems. Definitely not impossible, but that was definitely has not been the focus of my marketing efforts right now. But I have received quite a few referrals from movement disorder clinics and from doctors more recently. So I think now that the word is getting out and patients have reached out to me directly and then have had positive experiences with myself or my staff, then that goes back to the doctors, and the doctors are more willing to refer to us.
Makes sense. I mean, I always thought that mobile therapy it's a very unique approach to treatment,
Mhm.
and it's slightly easier to market versus marketing an outpatient clinic because I'm sure doctors refer to outpatient clinics, but when you tell them you're doing services in a home and it's not home health, it's definitely positioning yourself in a very unique way where I'm
Mhm.
sure doctors know that elderly patient that has a hard time getting out of the house or just not as committed to kind of completing therapy in outpatient setting, they're more likely to refer to you. But you're right, I hear mixed feedback. Some patients, some therapists are telling me that they have the most success with doctors referrals, and some are saying I'm not really getting anything from doctors and it's not my primary source of referrals. Okay,
Yeah.
very good.
Big thing
Well,
is we're focusing on word of mouth referrals because that's
that,
the best you can do is
that's the
word of
best,
mouth.
right?
So,
Absolutely.
um, yeah.
Yeah. Absolutely. But when you're starting out, you don't have enough patients to recommend you.
Mhm.
So the goal is
Yeah.
to see what's working for other clinic owners, right? Uh,
Hmm.
that's something people always think about when you're starting a clinic, right? Which way should I market? Do I pay for Google
Hmm.
ads, Facebook ads? Do I go to see doctors? Do I publish in, I don't know, newspapers, publishing ads in newspapers, right? So
Hmm.
I think it's important for people to hear what everybody's using in different parts of the country. Okay,
Yeah.
very good. Chloe, and then in terms of reports, do you run any reports? And if you do, which ones do you run? Um, And if you don't, why didn't you run reports? So I guess that's my next
Yeah,
question.
so as far as reports go, I love using I think it's the therapist invoice. I don't know, it's on my favorites. So my therapists get paid per unit that they see or per visit. So that's super easy way for me to just track the units and then I know, okay, this is how many units they've seen the past, 2 weeks. We do biweekly, and then I can just calculate it, put it into my payroll, and then it's done. So it makes it super easy instead of having to go through every single visit and figure out, okay, how long did they see this person for? Because we see people from an hour to 90 minutes long, just depends on what the client needs. So it's not like every single time is, 30 minutes, 45 minutes. It's really individualized.
Uh-huh, interesting. So you pay per unit.
Yes. Hmm.
Oh, and okay, so then so the report you're talking about, it's within the EMR system, correct?
Yes, that's correct.
Which
Yep.
EMR system do you use?
I use HelloNote.
Oh, okay. So you actually use HelloNote. Very
Yes.
good. Okay, so
Yeah.
therapist invoice. What else? Any other reports?
So in HelloNote, I love the dashboard feature is because it kind of just lays out and summarizes pretty much everything that I need to know. There's probably even more in there that I haven't even delved into, but the basics of what I need is on that dashboard page. So I'm always looking at what plans of care do since we are Medicare, mostly Medicare based,
Mhm.
needing to see like when we need to recertify patients because typically with people with neurologic conditions, we see them longer than other maybe practices would. So we're not seeing people for a month and kicking them out. We're seeing them
Yeah.
6 months, maybe a year, depending on what their needs are and if it's still skilled physical therapy. So, recertifications, making sure that the doctor has signed off on the plan of care and it gives updates on whether or not that has been sent yet, or if not, making sure we send it and seeing if we've received anything back yet. So, a lot of stuff on the dashboard is very helpful with the reports.
Great. And so you find the point of care report helpful to run your
Yeah,
clinic hybrid
yeah,
slash Medicare.
mhm,
Okay, very good. Very
yeah.
good. Okay. Chloe, and then for outpatient, right? So your goal to open up an outpatient clinic, do you think the challenges will be similar when starting an outpatient clinic versus mobile, or they very, are they different?
I think there's going to be some similarities and some differences. I think a huge benefit of mobile physical therapy is significantly less cancellations than you would see in the clinic. So
Yes.
I would foresee that would be a barrier in the clinic, but a way we can kind of navigate that is if they're not showing up to their in-clinic appointments, maybe they're more appropriate for their mobile visits and trying to navigate those situations. But I think there's a lot more overhead that goes with having a clinic where with mobile you can run pretty lean overall because it's not a lot of equipment that you need. You can go pretty minimum, and which I love because then I can pay my employees more and keep them happy and give them raises.
Yeah,
Because I want to keep my employees happy because they're the
absolutely.
heart of the business and
Absolutely.
they deserve everything.
I agree. I agree. And then would you say the lower overhead when starting mobile clinic is what, kind of reasons a lot of therapists starting mobile versus outpatient, or that's not the only reason people start out mobile clinic versus brick and mortar?
Yeah, I think a big reason is it's a lot easier, at least in my opinion, to open. You don't need as much capital or overhead. You can run really, really thin, with not much overhead. You can work from like a Google document if you really needed to, like spend little to no money to start. I always wanted an EMR system to start because I knew where the practice was growing and I wanted to set a good foundation. So I didn't want to change up a whole bunch of different systems. I wanted to set a good foundation and know that as I grow and as the practice grows, we had something that could grow with it.
Yeah, absolutely. And did you start with the same EMR system, HelloNote, from the beginning, or you had a different system first?
No, I didn't. I started with Jane and I really did love Jane, but as far as like Medicare compliance and audits, it just did not have what I was looking for. It was really hard for me to track what other therapists would do. At least they just didn't have that system in place, whereas HelloNote really had the systems in place of I could see everything really quickly and easily to navigate. And for me, it seemed to be a lot easier to bill through HelloNote. So the team has been great at helping me or asking any questions related to billing of why something's not working. So it's definitely been a lot easier to use HelloNote.
Yeah, speaking of compliance, yeah, we actually had quite a few clients in the last 3 months reporting that they passed the Medicare audits with flying colors. So that's
Yeah.
it's really kind of great for us to hear, because we know that compliance is an important aspect. And honestly, I hear a lot of therapists afraid to start a clinic because, or accept Medicare because they're afraid of audits and stuff. But I think if you have the
Yeah.
right systems in place, right, including the EMR that has compliant, kind of documentation, I think it's an important factor, right? Speaking of billing, so that's something I didn't ask you. So you guys doing billing by yourself, or you have a billing company? Was that a challenge if you're doing it by yourself?
So I started out with billing on my own because I wanted to know how everything works in the business. I didn't want other people to know and me not know because if for some reason they ever
Very smart.
left or
Yeah,
something happened, I need to know what is going on,
absolutely.
how things are run. So I definitely started with billing on my own. And then when I was with Jane and I was building up my caseload, I was so busy, which was a great thing, but then it just left me very little time to figure out all the billing stuff. So I decided to hire on a billing company that I used with Jane. I didn't love them. And then once I switched to HelloNote, I said, I'm going to take the billing back over, see if it's a little bit easier, which it has been. It's been light years easier for me to do, and it's very quick, efficient. So I now do the billing for all of us, and it's very easy, which has been
How,
very nice.
sorry for interrupting. So how long
You're
does
good.
it take to complete billing on a weekly basis? Like if you were, average it
Um, Maybe 20, 30 minutes total.
per week, correct?
Yeah.
All right. That's
Yeah.
that's
It just
impressive.
depends on how many things. Some I'm still working on some things, making sure they're getting into the right billing system. So that's more just on my end. I'm getting things organized, but everything that's in the system, it's very
Yeah.
quick. There's, a few clicks of buttons, drag things over, import and submit, and it's very quick for me.
Nice, nice. And do you run billing reports? That's something you run for the clinic?
Um, I wouldn't say like traditional billing reports, but I am just looking kind of on the back end of what's due, what patients' co-pays, co-insurance, what's been paid, what hasn't been paid yet.
Yeah.
I just kind of keep an eye on that on the back end, but not run specific reports related to it.
I mean, yeah, paid and non-paid is like there's a report for that, and like
Yeah.
aging reports, it's like 30-day aging report
Mhm.
or 60-day kind of thing. Okay, so makes sense. And
Yeah.
you know what? I actually, when potential clients reach out to us, and if I speak to them, there's a constant question: should I hire a billing company, or should I do it by myself? So I actually tell people the same thing. It's beneficial to know how billing works because
Yeah.
regardless of who you hire, right, or if you outsource the billing or do it in-house, you still want to know the process, right? The back, kind of the back process. And if God forbid, the biller that you hire leaves or something, you still want to know how to submit those claims and check. There should be checks and balances because you
Mhm.
you you kind of you trust but you verify, so to speak, right? You still want to
Yeah.
know the collecting all the dollar amount they were supposed to collect. Um,
Hmm.
anyway, Chloe, it was great talking to you today. Thank you so
Yeah.
much for your feedback and for telling us, about your clinic and your goals. And I'm hoping to speak to you next year to hear more about your clinic and what you're doing in a year from now, if that's okay.
Of course. Yeah. Thank you for having me today and thanks for sharing HelloNote with the world. It's been awesome to use, so I appreciate it. Makes my life
Thank
a
you.
lot easier.
All right, so that's good. Off the record. Thank you, Chloe. Appreciate your
Yeah.
time. Yeah.
Thank you.
So you're Yeah, outpatient clinic. So you're planning to do it this year, or you're that you haven't decided yet?
I would like to. It's just trying to figure out, what the next steps are of building and growing and trying to find the right space that we can that's not too big and not too small, because I do want the physical therapy side and the wellness group fitness classes. So,
Yeah,
um, yeah, I've been toying with the idea of maybe seeing if I could like rent a room from someone and seeing if that works out. But a big thing is a lot of people just love in-home. They just love the
yeah,
convenience of in-home therapy. So even like some of my clients that love working with us, it's hard to get them to come to anything in person because
yeah,
they're used to having
absolutely.
stuff at home.
Yeah, I mean, I just for full transparency, I have stakes in mobile clinics and outpatient clinics. So I've been through this before, so
Yeah.
it's very different. It's interesting. So for the clinic in New York,
Hmm.
so uh, I have stake in a clinic called Rehab on Wheels, which is
Hmm.
a model you have. It's an outpatient physical occupational therapy clinic, and the majority of referrals, maybe not now, but even last year, were coming from doctors. We're talking about probably 75%, right? Versus outpatient clinic, or a small outpatient clinic here in New York City, it's complete opposite. It's word of mouth. Google,
Hmm.
Google is amazing.
Yeah.
Not as much for elderly, but for, like I said, outpatient younger people. They
Yeah.
go, they research physical therapy near me, and Google's honestly been the best referral source for us, and then word of mouth.
Hmm.
So it's interesting to see how mobile, clinic has one way to we have one way to get patient versus outpatient clinic is slightly different. So the processes are different. But
Hmm.
I always thought, I mean, neurological, when you serve neurological population, the size of the clinic tend to be slightly larger because you need more space, for
Hmm.
training and things like that. So
Yeah.
that's also, could be a challenge with the
Hmm.
mission.
Yeah. We can't just have like a small room.
Right.
It's just like a
Right.
corner, like we can't just have a corner office. I think it wouldn't work with what we need. So you need a decent
Absolutely.
sized space, but not something so big where it's expensive and then we're not paying attention
Absolutely.
to the bottom line. So
Yeah, yeah. It's always a challenge starting out. Like, how big of a
yeah.
space do I get? And what if I don't have enough patience, to break even?
Hmm.
So but hey, if you don't take the risk, then you don't know if you're going
Yeah.
to be successful. All
Yeah.
right. Well, thank you so much again for your time
Yeah.
today. It was really informative. Thank you for sharing your journey.
Of course.
Like I said, I'm looking forward to speaking to hopefully next year if you're willing
Awesome.
to see where you are. All right. Thank you.
Thank you
All
so
right.
much.